Funny patient story. Hi, I'm internal med doc, a board certified internal medicine physician in primary care, taking care of patients for 20 years. Here's something kind of interesting and funny that I noticed the other day. I was seeing this gentleman, healthy, older gentleman coming in for an annual checkup, and we're talking about mental health, and he was telling me how he's kind of stressed and anxious about the upcoming election. Now, talking politics in the doctor's office is an absolute no-no in my rule book. I never do that. My patients generally don't do that, and this gentleman realizes that too because he didn't really mention who he voted for. He has a little I voted sticker on because I think he voted earlier that day before coming to see me. So whatever, I let it be, and so I'm looking through his chart, just to, see what's going on with this gentleman. I looked back at last year's visit just to see what we talked about, what are some things we discussed, and I noticed in the vaccination section of my electronic medical record, I made a note last year, patient refuses all vaccines. So then I pretty much realized, okay, I know who you voted for. I know, I'm just guessing, I could be wrong, but the fact is there is good data published over the last few years, especially since the COVID pandemic and the whole COVID vaccine schism in this country. It's pretty safe bet to say we know who people vote for based on their opinions about vaccines. What's really funny are people who are very public about it, like on social media and TikTok, who use not getting vaccines as this political flex, like, I'm sticking it to the man by not getting the vaccine. The whole thing on one level is hilarious. On a more public health level, it's kind of sad because there are health outcomes that are not going to be achieved in certain populations that are under or lowly vaccinated. And if you're wondering if I tried to educate him or inquire more about it, I honestly didn't, because we live in a world now where people are so divided over this. I simply just don't have the time or energy to make a case anymore. In primary care especially, I wish I had more time with my patients. I don't, so I kind of have to triage and prioritize high-yield things. And obviously this is not a high-yield topic for him personally, even though for me it is. I decided, you know what, I'm not even going to bother trying to make the case. I'd rather focus my time on more important things with that patient. Sad but true. Now, I'm willing to have those discussions if the patient wants to have that discussion, right? If you're open-minded about it, you want to learn, you ask genuine questions, you have genuine concerns, I'm happy to make the time to discuss it. But there are folks that are just simply completely shut off to this idea. So ain't nobody got time in primary care to convince people to do the right thing when you've got conspiracy theories and all sorts of nonsense clouding your judgment.